Well, greetings and salutations, everyone. My name is Dr. David Harwig. I'm a doctor of physical therapy and owner of Atlas Health and Wellness and a wellness company. I'm located in Stuart, Florida, inside of Powerhouse Gyms. We just opened up in late July, and we focus on preventative physical therapy as well as other physical therapy problems. You got back problems, we treat that too. But we also like to help prevent issues from happening. And today we're going to be discussing a study that was published in 2013, I believe. Take a quick check there. Yes, 2013. Which exercises target the gluteal muscles with minimization of activation of the tensor fasciae lata, electromyographic assessment using fine wire electrodes. Fine wire electrodes versus surface electrodes. So this is, they put the wires directly into the muscle to read activity of specific musculature. And so to give you a little bit of background, abnormal hip kinematics and impaired hip muscle performance have been associated with various musculoskeletal disorders such as patellofemoral pain syndrome, iliotibial band syndrome, anterior cruciate ligament injuries, low back pain, and hip joint pathology. For example, several studies have reported that there is significant weakness in the hip abductors, external rotator, and extension with associated increase in hip internal rotation and knee abduction or valgus during functional tasks in persons with patellofemoral pain compared with pain-free individuals. Agreed. There's lots of references there. Based on apparent association between hip dysfunction and lower extremity injury, there has been an increased focus on hip muscle strengthening as part of rehabilitation protocols, as well as preventative care protocols, which don't exist because insurance doesn't pay for those. Primary muscle actions at the hip are well known. The middle portion of the gluteus medius is an abductor, and the gluteus maximus is an extensor and external rotator. However, the superior portions of glute max also act as a hip abductor during gait. As such, enhanced performance of glute med and glute max has been recommended to control excessive hip abduction and internal rotation with weight-bearing activities such as squats and running and things like that. So what they did is they had them do several motions, several different exercises, which I'm going to go over briefly. Scrolling down here to the pictures. Pictures are always helpful. So straight leg raise, hip abduction, clams, hip bilateral bridge, unilateral bridge, hip extension with knee straight, hip extension with knee flexed, lunges, squats, the monster walks or sidestepping with a band, hip hikes, forward step ups were all included in this. Unfortunately, they didn't do the back extension thingamabobby. I would have been interested to see that, where you lock your feet in and you extend from the gluteus maximus, which is how you should be using a back extension chair or the thing you lean over. And a lot of people use the paraspinals, but I would have been interested to see that included in this study as well. So what they did was they inserted the needles or small wires into the muscles, and they had them perform these exercises to see how the muscles performed without the activation of tensor fasciae lata. So the whole goal is to exclude tensor fasciae lata as or limit its activity in strengthening specific musculature. In the study, they did not mention anything about measuring range of motion, and also a limit to this study was also that they didn't have, these are pain-free individuals. So they don't have any patellofemoral pain syndrome. They didn't have any back problems, foot problems, etc. So they were just, normals, if you will. So take that with a grain of salt. Take it for what you will. And so I'm going to get down to the nitty-gritty. Apparently, the most effective at activating gluteus maximus and the superior fibers of gluteus maximus and gluteus medius and limiting tensor fasciae lata was as follows. Clamshells were the best. Sidestepping was second best. Unilateral bridge followed by quadruped hip extension, knee extended, hip extension, knee flexed. Then bilateral bridge was half of that, but because it's two legs, it's half. sideline hip abduction, step ups. The least active was the lunge, and you could argue that it's how they performed it. And I want to talk about that a little bit in this study. One of the things that I caught that was very unusual is that in this hip abduction sideline movement, that it was done against a wall. So basically, this individual was trying to do straight leg raise hip abduction with their hip not extending behind their not going into hip extension. So like when I teach hip extension or when I teach straight leg raise hip abduction, I actually encourage internal rotation of the hip and hip extension. So I was kind of shocked that they were like limiting their subject's hip extension in this movement, because I think it would have changed the results of the study. So bottom line, there's specific exercises that you can do to help maximize the strength of specific muscles. These muscles are extremely important in preventing as well as treating musculoskeletal conditions like low back pain and patellofemoral pain syndrome. If you don't know how strong your muscles are, we want to hit certain ratios, whether it's quadriceps to hamstring, whether it's hip abduction and strength in general, internal to external rotation of the shoulder joint. We're not talking about that in this particular article, but here at Atlas Health and Wellness, we believe in prevention. We believe that most of these musculoskeletal inflammatory conditions are preventable if they can be identified before there's a problem. So we go to the dentist, hopefully at least once a year to get a checkup to make sure that there aren't any problems that could lead to a cavity. Same thing with going to your medical care provider. You get your blood work done to make sure that your blood lipids are okay, that you're not presenting with symptoms or signs in your blood work that suggest cancer, because it is much easier to treat the problems before they become symptomatic and kill you. So musculoskeletal problems may not result in death, but they will result in morbidity and a less likelihood of taking care of your heart, which will lead to an earlier death. So anyway, schedule your free wellness evaluation with Atlas Health and Wellness. Our phone number is 954-932-8527. If you have questions about what we're doing, shoot an email over to info@atlashealthandwellness.com. My wife will forward that to me, and I will get back to you as soon as I possibly can. Well, that's all we have today. So apparently, the most effective exercise at activating your gluteus maximus superior fibers is the clamshells, which I found kind of surprising. But I'd also like to mention that they did not do the exercise where you lock your feet into a back extension. I forget what the heck that thing is called. It's not the Roman chair. The Roman chair is the opposite. But anyway, there is some limitations to this study, I will admit, in terms of what they're trying to achieve and how they did it, especially with the straight leg raise hip abduction not getting into extension. That's kind of strange, because the unilateral bridge with hip extension, these hip extensions with quadruped all went into hip extension. It looks like he actually has a mild hip flexion contracture. I don't see him getting into hip extension. I see him approaching it, which is kind of interesting. So if that's how they were measuring it, I think we could have done a better job at that. But, opinions are opinions. Everybody's got one. Anyway, my name is Dr. David Harwig, owner of Atlas Health and Wellness. We're signing out. Look forward to meeting you soon.